Perfect. It is 3 p.m. Thank you so much, everyone, for joining us to this Fire Notes session. So the title of this session is St. Joseph's Healthcare, Hamilton Streamlines Referral Management into Epic. And so before we start, a few little housekeeping details. So if you have any tech issues, let us know in the chat, and our tech assistant will be able to help you out. In terms of questions for our speakers, if time allows and they have time at the end of the session, they'll be happy to answer any of your questions, so feel free to let them in the chat. This session is being recorded and closed captioning is available, and you can adjust the settings in the box below. If you want to have this session recorded on your attendance certificate, make sure to complete the check-in survey. Perfect. So today we are welcomed with Anuba Sant, which is the project manager at St. Joseph's Healthcare in Hamilton. We're also here with David Walter, which is the business applications and integration manager of St. Joseph's Healthcare Hamilton, as well as Yaron Derman, which is the director and product of Cognizant MD. I will now share them the access, and they could go ahead and start the presentation. So David, are you able to share your screen? Is it working? Perfect.
Thanks, David. Thanks, everybody, for attending our session, inviting us to speak. I'm Anuba Sant. We will be providing you a project overview, and then David and Yaron will walk us through the technical architecture. We have some time left to share with you post-go-live business outcomes and lessons learned from the project, and then we have some time saved for questions and answers, if you have any. Next slide, please. Just an overview on St. Joe's Hamilton. We are the leading mental health hospital here in the Hamilton region, and do provide services, various services, both inpatient, outpatient for Hamilton, the Hamilton community, and abroad. And we are enabled through the Epic install with Dovetail as our hospital management, the hospital information system. Next slide, please. This project has occurred in collaboration with the e-services program. Some of you might be aware, e-services program delivers digital services, including e-consult and e-referral across the province. And specifically, our partnership for delivering this project has been with the Center of Excellence, eHealth Center of Excellence, and we're excited to share with you the motivations behind the project and some business outcomes. Next slide, please.
Okay, so I'll take it over. This is Yaron from Cognizant MD. So a little bit of background around Ocean. So Ocean is actually a platform, which is an EMR add-on, which provides a suite of tools that assist providers to engage their patients, as well as to facilitate communication between providers, with e-referrals being one of those types of communication. Two of the key components of the Ocean platform that are really core to the e-referral project are the fact that Ocean has a very robust e-forms engine, which allows providers to specify the specific types of data that they want to collect from their patients, as well as from other providers, so that they get the right information to make a decision around their e-referrals, whether to accept them or whether there's another provider that would be more appropriate. So that's what really allows them to customize their e-referral forms. But the other piece is the integrations. Next slide, please. And you'll see on this slide that Ocean has a large number of integrations. Our primary integrations, you can see the column on the second left, are with the 4 leading EMRs in Canada, which are QHR Curo, TELUS PSS Solution, Practice Solutions, TELUS Med Access, and Well Health's Oscar Pro, as well as with Oscar. And so what's great about those integrations is that it really facilitates the provider's ability to create an e-referral very quickly, because it pulls the patient information and some of the core demographics, as well as their own information, into their e-referral. So they're able to quickly fill out an e-referral form. And then the connection with Ocean allows them to stay up to date with what the status of the e-referral is, and allows them to download the e-referral over time. So from the primary care provider and specialist sending the referral perspective, they're very keen into accessing the facts, because for them, this is a much more efficient approach that works together with EMR. And so we're seeing in the Ontario e-referral network that many of the service providers that are on the other side receiving the referrals are adopting the Ocean platform to perform e-referrals, but more importantly, are looking at integrating with Ocean in order to be able to get the value out of that streamlined referral management. So you'll see on the right-hand side, we have many mature integrations, but on the left-hand side, which is the focus for today, is our FHIR e-referral integrations, with St. Joe's being at the very top with Epic. But you'll also notice that we have many other projects that are either in development or planned for the near future, including with other HIS vendors and other EMR vendors. So really the goal here is to build out a robust e-referral ecosystem that the province will benefit from an efficiency and patient-centeredness perspective. And with that, I'll pass it back to Nuba.
Thanks, Yaron. So at St. Joe's, we went live with Ocean as our e-referral platform last July with our diagnostic imaging. At the time when we went live, our diagnostic services enabled Ocean as a standalone platform, which essentially meant they were logging into Ocean in parallel to logging into our Epic system, which is our hospital information system. And very quickly, we did notice just the benefit of having e-referral, including having more appropriate information as part of the referral, more legible information as opposed to the referrals that are faxed in, a full data set to make clinically relevant decisions. So very quickly, we saw that just the shift from fax to e-referral made a difference from our clerical standpoint in terms of administration, being able to turn referrals around quicker, but also from our physician standpoint of being able to have a valuable data set to make clinical decisions on accepting the referral versus rejecting the referral, as opposed to in the prior world of fax, where our clerical staff were essentially playing phone tag with referring clinics to obtain information that may have been missing in the referral that was sent in. Seeing the successes within diagnostic imaging, we expanded Ocean as a standalone solution into our 3 additional programs: Connect MHAP, which is our mental health and addictions program; Hematology, which is an outpatient specialist clinic; and Nephrology, which is also an outpatient specialist clinic. And as we started to see the benefits that our clinics were realizing using Ocean standalone, the inspiration for this project came to really integrate and make Ocean part of our Epic workflow, which is the central point where all our clinicians and clerical staff interact with all of the health information that resides in St. Joe's for our patients. Next slide, please. The approach we took was a 4 sub-phase approach, 2 large phases. The first phase was single sign-on through the Smart on FHIR standard, and really what this did was reduce the barriers for our clinicians and clerks to log into Ocean. So for phase 1, which was delivered earlier this year, what we were able to demonstrate was a non-patient context launch out of Epic directly into Ocean, such that our clerical staff could access their referral work queues, our physicians can access the work queues, and essentially reduce the barrier of needing to sign in. This was an early win for our clerical staff from a workflow perspective, but given the volumes of e-referrals that were starting to come in, we recognized that we needed to do a deeper integration, specifically at a data level, which I'll go into But once we accomplished phase 1A of the single sign-on, we were also able to integrate Ocean within Epic such that Epic could launch Ocean with patient context and provider context to refer out of the hospital. This was a phase that we were expecting to actually deliver later on in the project. However, given sort of the existing backbone of Smart on Fire through phase 1A, from a technical delivery standpoint, it only made sense to bundle them together as they were using similar technical backbone. Our phase 2A and phase 2B were essentially the data level integration supported by middleware, which David will be reviewing and architected. And this is where we have found the most value for our clinics from a standpoint of workflow, but also data level integrity within and reduction of human error from a transcription standpoint. So essentially what phase 2A delivered was the ability to receive the referral from Ocean utilizing the middleware into Epic, where our clinicians and our clerks are already used to working, injecting those into the work queues that exist. If patient records existed, filing the referral and any associated attachments to the patient's record. If there was no record match, then creating a new record within Epic and attaching all attachments and the requisition within. And then phase 2B really closed the digital loop of the e-referral workflow for us by notifying referring providers of the status of referral, the status of the referral being actioned and scheduled. Next slide, please.
All right. I'm David Walter. I'm the Business Applications Integration Manager at St. Joe's, and myself and my team did work on the integration. And as Anuba has just talked about, from a fire perspective, we did utilize Smart on Fire at 2 points within this. First of all, just for our contextual launching from inside our EMR Epic that would be there and leverage that. And then we also utilized the Smart on Fire launching with the patient context, which allowed us to then go into the health map, which is part of Ocean. And when the clinician were to create a new referral for a particular user, the functionality of Smart on Fire would pull patient information to automatically start filling in the referral, which again was a big time saver for the clinicians. The last part of it, which was really phase 2A and B, really looked at our data exchange between the two environments, between Ocean and in our case Epic. And really what we needed to do was create a data converter from essentially Fire, which was the Ocean side, to the HL7 V2, which is the Epic side. At the moment, Epic doesn't have an Fire interface into an e-referral of any sort. And so we needed to bridge the gap between these two diverse environments. And essentially what we were doing with this was taking the JSON data that comes in from Fire and converting that into the appropriate HL7 v2.x messages, and also doing the reverse of that, taking things that come in from the Epic world, which would be in HL7 version 2, and then converting that into the appropriate JSON messages and sending those off to Ocean. The other part of the data exchange was that we were bringing in documents. Documents are very important as part of our referral system, and these documents would be retrieved from the Ocean system and then moved into our EMR, and we will see some more details on that coming up. Our architecture was really structured that at the top here, we basically had our Smart on Fire integration between our EMR and the Ocean system. But the data integration was really performed by what we call the middleware. And there were a number of components to this to allow things to work as part of it. But this was all self-contained on a single virtual machine. that did provide a gateway between the two different environments that we have there. Getting into a little bit more detail on this, the middleware components, we did set up an Ocean endpoint to receive the bundles that came in from Ocean when a referral was created. We used the .NET application API code to support that. We set up an OAuth 2 endpoint for authentication using the Identity Server 4 open source product that's part of the .NET environment. We did create a processing service, which was a Windows service that ran on the particular virtual machine, and we'll see more details about that momentarily, but it was the core for receiving messages, triggering messages outbound to the various partners that are part of that. We have a management tool that we've created to give us some insight and to build components in the database, SQL database we have, and that again is a .NET MVC application. We're using SQL as our main database functionality, and we're also using the open source Mirth engine as part of our middleware, and I'll come back to that as well. It may not have been needed, but it did, from our perspective, simplify some of the work that we did in developing the middleware. From our EMR, our Epic environment, we did have 4 interfaces, ATL7 v2 interfaces that were used, 2 being inbound to Epic from the middleware. There was a patient administration, which was used to create and or update patients. The referral orders, which was the key one for bringing in the referral information. We then had 2 outbound interfaces from Epic that provided us notification information both on referral activity, which was important, as well as patient scheduling. As a patient was scheduled based on the referral, for example, for a Connect MHAP appointment or for DI appointments, that information would flow back and then update the Ocean referral. The processing service really was the core foundation for the information exchange between the environments. It processed the inbound JSON bundles that represented the patient information and clinical information. It was also the component that received the documents, and we stored the documents in the database in a base64 format. It was also the code that created patients, because in our particular environment, we could have net new patients to our EMR or recurring patients that have been at St. Joe's before, as well as being the ability to create the referral data for Epic. The middleware processing service also processed the inbound messages from Epic. So when it received a referral message from Epic, that was basically to trigger saving the documents in our document management system here. When a referral was triaged by the appropriate clinic or clinical folks, there would be a status for that. So whether the referral was accepted or rejected, we would need to send that back to Ocean. And then as a referral moved through its activities within the clinic, and it was scheduled, then scheduling events, initial scheduling, rescheduling, canceling of it, those types of activities would again trigger updates that would be sent to Ocean and update the referral status in there. Another key component that was very important for us was the mapping of discrete Ocean referral questionnaire data into Epic referral questions. So Yaron talked about the complex and powerful referral editor, and it really is something that is very much true. A great amount of information can be collected by the product Ocean, the portal, from the person, the clinician creating the referral. And then what we decided to do was to map that information discretely into our EPIC referral. And in the EPIC world, we have for referrals, we can have these questions with answers with it. And so we took an approach in our initial implementation to discretely map some information, not necessarily all of it, but to also utilize the referral document that had all of this complete information in as part of it. So it's a combination of discretely mapping the questions in addition to having the referral documents, the referral document and any attachments with it as well. Some of the questions that I've been asked when I presented this before is, why did you use Mirth as part of it? Because you now be connecting one interface engine to another engine that we have here at St. Joe's. And the primary purpose of that was basically to remove all HL7 from my code. And it allowed me to basically read and write to tables, SQL tables, and then Mirth then would pick up, be depositing information as well as reading information from these particular tables. And it simply allowed us to expedite the development of our prototype, so to speak, as part of this, because I didn't have to sit down and implement any kind of HL7 functionality. Even though it does exist to packages, it exists within the .NET world, we chose not to use that and basically had Mirth as a pass-through from one engine to the other. And it has worked well for us to this point. Yeah.
So I'll jump in here, and this is sort of the mirror image of what David was speaking about on his end. So on our end, the HL7 Fire APIs that we offer are R4 based, and more importantly, they're based to conform with the Ontario eReferral HL7 eReferral standard that's available from Ontario Health's website, or from eHealth Ontario formerly. And just a shout out to Tim Beresny from CareDove and Karen Harris from Orion Health for leading up the group of vendors and organizations that participated in putting that spec together. And so that was really what we used in order to build out our service to send the service request bundle, which is the initial eReferral payload, down to David, and then whenever we get any sort of updates on our end, we send the same service request bundle with the update down as well. To retrieve things, as David was saying, we have 3 endpoints. So the first one is whenever there's an update on the EPIC side, then that's posted to our status updates endpoint. And then there's also the ability to pull down any attachments that the sending provider added to the initial referral to add into the patient chart. And finally, where it's desired, there's the ability to optionally also pull down a PDF version of that referral, which might work better for some systems rather than doing the discrete path. So those 3 endpoints are protected by OAuth 2, as David mentioned. So inbound, we expect an OAuth 2 before hitting those endpoints. But on the other side, we do support several different options. In this case, David mentioned OAuth 2 on their end to authorize what we're sending down to the other system. The critical success factor from our perspective, I think from this project and those going forward, is really that there's the ability to self-serve the setting up the APIs and the authorization by the site building out the integration. Besides the fact that we have to add them to our allow list, everything else they're able to do on their own. They can obviously reach out for questions, but everything else is configured and set up by the integrating partner, so they can move at their own pace. I'll pass it back to you.
Thank you. And I will just chime in on the last comments that Yaron has made. It was very simple for us. We have a very easy process that we follow, and probably 10 to 15 minutes is all that it takes to actually set up a new clinic and have the integration set up for it. So that was a huge advantage for us from that perspective of ease of integration with Ocean. Some of the things that we do from a data integration perspective, you've heard we talk about before. The idea of patient creation was very important because we may have patients referrals being created for patients that we've never had before. So a very important part of this was being able to absorb that information and go through processes part of that. And so we have within the HL7 interfaces right at the moment within Epic, patient matching algorithms that are in place, and this particular interface does support all of that. So from a health records perspective, we're using the same criteria as if a person were registering effectively at ED or any of the other clinics that we have when new patients come in or existing patients come in. So that was a very important thing, and the interface, the HL7 interface that we chose with Epic does actually allow that patient creation. The referral creation gets to be a little bit more complex in that there's pieces of information that we need to pull from the bundle to provide for that. The type of service being needed directs us to the right clinic, the provider as well. That type of information needs to come in when we create the referral. You heard us talk about the PDF documents that do get stored in our document management system, which is called Quantum, and links are provided back to the actual encounter that the referral order is attached to. So all people looking at that particular referral order have access to both the referral PDF as well as any other attachments that the initiator has attached. And then the referral question content mapping. And this was a big discussion that we had amongst ourselves internally. How do we actually do this? And we chose to really implement sort of a middle ground for this. The extremes would be to map very little from the Ocean referral and have people refer to the PDF referral document. The other extreme of that would be to try to map everything from Ocean into referral questions that we have discreetly to do that. And we chose middle ground, which was to map certain information so it was discreetly available. And once it's discreetly available in our EMR, then it can be used for reporting and other types of activities. And that's what we attempted to do, to find that middle ground as part of it. And the way that we did this was every question in the Ocean referral has unique ID associated with that. That was put into a whole variety of OBX segments on the actual referral order. And we then built out in Epic those Ocean referral IDs as being alternative values so that the mapping was done quite transparently as part of that through the process. A high-level flow to kind of give us a picture of a sequence of activities and events that would happen. We would start at the top with a JSON bundle coming in with information. The middleware would receive that. It would then process that and retrieve the documents. And Yaron has identified the two endpoints for that we would call to bring in the information. And we did test this because there is no limit to what within our design to the number of documents that are supported, and we have seen a range of documents that providers are attaching to it. Once we have the bundle and the document information, what we then do is process that information to send the patient information to Epic via ADT message. And then we would send the referral information to Epic for that. And once we receive the notification from Epic that the referral has been processed, that would then trigger the flow of information to save the documents into our Quantum, our document management system. And that would then also create a link back into Epic as part of that. We then have a time lag because once the referral has been created, it needs to be triaged, and there are workflows that are followed by the different clinics and areas that we have integrated with. But at some point in Epic, a referral would be triaged, accepted, or declined. That would trigger the HL7 message, and then the middleware would send a task JSON update that would say it's been accepted or declined. And then at some later point in time, scheduling activity, an SIU message would flow across, and we would send an appointment JSON resource, and that would update the Ocean referral as well. And so this is really an overview of the flow between both the Ocean side, Epic, and how the data is interchanged back and forth. Just to show you a little tool that we created, and I did identify this as the MVC application in our architecture. We've created this application to kind of show us the status of the different referrals. Maybe difficult for you to see, but we have the referral information, and the color coding here allows us to see how it's been progressing through. So red is bad, orange, yellow, green, and dark green is kind of our flow, and allows us to see the referrals, what status they're sitting in. There are some timestamps that get listed in some of the columns on the right, and we can see the activities taking place as part of it. So this is a tool that we use for our IIT, both myself and some of my staff, to be able to monitor the activity that is happening within the system, to make sure we don't have any issues with anything that's there.
Okay,
A couple
so I'm
of
going to jump in.
okay, yep.
I'm going to jump in over here. Really, obviously, the real value of this integration is really the value it provides to the providers and to the patients, keeping them up to date, making referrals faster. But because this is a Fire North conference, we should talk a little bit about the value of standards and the value of HL7 Fire particularly. I think, starting from the top, my background, I spent a number of years in the digital health standard space. And I think this is a textbook example of the value of standards, and specifically the great plans that went into building out Fire. From the get-go, let's start with talking about SMART. Our organization did work with the Epic Sandbox originally, even before we engaged with St. Joe's, to build out our client app launch. And but then once we started working with St. Joe's within the production environment, as everybody knows, production isn't always the same as Sandbox, but it actually was very similar. There was very little need for us to rework. But what's even better is that we've been able to reuse the same SMART with other HIS systems, as well as with other launching systems, as you might recall from the beginning slides, for instance, with Dapasoft. So we really are getting that reuse and leverage out of the SMART standard. From a Fire perspective and from an iGuide perspective, what was great about that is that there was already a template for how we could have confidence if we're building e-referral Fire APIs, that we know we're going to cover a good chunk of pathways because of all the great input that went into designing that iGuide. And we can build it on our end, and asynchronously, partners can start building on the other end using the same iGuide without us having to have a lot of project negotiation, which can slow things down. From a perspective of actually working on the APIs, our team did not have a Fire background when we started working on them. And because of the fact that Fire is based on internet standards, JSON, REST, and all the other good things, we were able to very quickly build out with very little rework. I think, again, that really speaks to the great foresight in planning out Fire. We did build out our APIs, as we mentioned, so that self-serve. So now, again, we're able to allow multiple partners to start building their integrations asynchronously from us. We have lots of documentation available to them because Fire makes it available from the core standard. The provincial standard is available, and then our own API documentation with Swagger and support guidance is available. So projects can move at their own pace to the degree that I sometimes don't even know where they're at. But what that also enables is then St. Joe's was able to go ahead. David was able to actually start testing the APIs with Postman because of all the fact that we're using internet tools. That he's able to do all sorts of testing even without having the middleware stood up. And so that, again, allows the project to accelerate its own pace. So I think the testament to that is we did have at that time 4 projects going on in parallel. For a small shop like ours, that would probably be too much if it was where we had to do customized planning and integration with each partner. But I would think we put somewhere between 5 and 10 hours per month per project, and we're seeing great success with that. So first of all, shout out to all the great people working on FHIR as a standard, and also in the province, but also to vendors. I do really encourage you to explore this route. And with that, I'll pass it on to Nuba to talk about the real value, which is to the patients and the providers.
Thanks, Yaron. From a St. Joe's perspective, this project really has been able to very quickly demonstrate value to each pillar, or in this case, quadrant of the quadruple aim. Looking at the improved patient experience, just e-referral in general has started to now provide patients insight into their referral pathway, which previously in the paper-based world was not as transparent. And now with a full end-to-end digital integration from primary care to the acute intake area, patients have a line of sight directly into their referrals. Looking at the physician experience, it certainly has improved for us the intake physician or the consultant physician's experience, because they've been able to really guarantee that the content of the quality referral they're getting in is sort of, base standard of what they need, with clinical information to appropriately make a clinical case and have enough data to assess the appropriateness of the referral. And then from a referring provider standpoint, we've certainly heard from our clinicians, our clerical staff, that many primary care providers are preferring this route now that we have the full integration, but also just being able to have standardization occur across multiple intake clinics at St. Joe's. So in our area within Hamilton, there are many, we see the providers who use Ocean are sort of repeat providers, and they do refer into multiple intake streams. Look, now we're having focused on improving the patient experience and the provider experience. Now we're really able to look at the improvement in patient outcomes from a standpoint of wait times and releasing time to care. So the turnaround time for patients to be seen and follow through with their referral journey, and also looking at cost effectiveness from a system efficiency perspective. So this project for us really has demonstrated and impacted each of these areas. And overall, having the referrals coming in directly now into Epic, as I had noted earlier, our clerks are much happier because they're not having to access a separate system to obtain this information. But the information that's coming in is saving them a lot of transcription time. So previously, our faxed information would need to be manually transcribed, but now with the mapping that the middleware has done and the architecture that David has created, there's just a lot of efficiencies that we're realizing from a transcription perspective, and the nimbleness of the implementation in itself. So as I had listed, we had 4 clinics live on Ocean, each of them very different in their workflow, very different stakeholders involved in the referral experience. Specifically with our hematology and nephrology clinic, they are physician triage clinics, which means that physicians are first line of sight into the referral. Having this data come directly into a system that physicians are already used to, as you can imagine, exponentially increases the value and the utility of physicians being open to trying a new method of obtaining referrals, starting to move away from fax. And then our other sites, or other intake areas like diagnostic imaging and Connect MHAP, which are clerical triage, but in diagnostic imaging, we have requirements for protocoling, et cetera, really being able to adapt the workflows supported by this middleware has been incrementally valuable to our group. And we're hoping in the next few weeks that we can share an implementation guide with other Epic organizations who wish to enable this type of transaction within their environment, so that we can start really doing that shift from fax to e-referral and really be able to do the system level transformation of being able to follow a referral through with a clear line of sight, as opposed to some of the challenges that we have noted previously in the system through fax. So I believe this is the formal or very close to formal end of our presentation. We will open this up to any questions that you may have. I do see a few have come in over our presentation.
Perfect. Thank you so much for helping out and getting the Q&A started. So yeah, as like Anuba said, you could leave your questions in the chat option and also keep the conversation going with https chatfire.org/login. So you could also keep the conversation going as well. Perfect. Let's get right into it. So the first question I see here from Joe Verasso from Mohawk College asks, does St. Joe's use .NET a lot, or is it a .NET shop?
We use .NET for pretty much all of our custom development that we have, where we use Microsoft for we're a Windows-based environment for both desktop and servers. And so, yes, we do use .NET for our custom development.
Perfect. Hope that answers your question, Joe. As well as another question that came in from Rajiv Nair from Island Health. Hi, wonderful and very powerful API. They use the Cerner Island Health in Victoria, BC. They typically encounter the table as starting point for any analysis, where the patient encounters are stored and updated with events like registration, transfer to a ward, discharge, etc. Do you have any recommendations or possible template that can be transferred to other platforms like Cerner? Again, wonderful platform.
So again, because we created HL7 as the output, Cerner and other systems would have equivalent interfaces to Epic. So in a sense, you could model the integration to any other EMR that had some sort of interface to do that. There may have to be changes to how things like the discrete data mapping goes. We've chosen to really link the Ocean side to the Epic side, and the middleware doesn't do very much with respect to that, but the middleware could act as a translator to that should there be any other way that the discrete data needed to be translated into the HL7. Now, if the EMR has a FHIR interface, then I would suggest a straight direct FHIR integration with the Ocean environment as part of that.
If I can just jump in there, thank you, David. I think that's definitely the first comment I would make. That additional information is we are in discussions with Cerner Canada around a Cerner-wide integration, which would mean that it would become something that would be available via your Cerner Canada. So that's something that you might want to consider, as well as reaching out to your Cerner executive and account executive and just finding out when that might become available. So that's another approach as well.
Perfect. As for the next question from Russell at Jevity, thanks for sharing your experience in implementing both inbound and outbound referrals between Epic using Ocean. Do users at the hospital launch Ocean directly from Epic's UI with user and patient context to support the creation of outbound referrals, or inbound, or both? And then the second part question, can you share more information about the users of this functionality and the impact on their workflow?
So I will say yes. We have buttons to launch from inside the Epic's hyperspace world is where this launches. And so at the base level, a button will provide essentially single sign-on once the user has logged in once. When that user is in the Epic, the EMR, and they click the button, they will launch into their corresponding Ocean account in a new browser window. There also is the functionality for the creating a new referral, and perhaps Anuba can chime in here. That's only for certain users, correct, that have that ability?
Correct. So for outbound referrals, these are physician driven. So from a workflow perspective, it is the physicians who have the ability to launch out of Dovetail into Ocean with patient and provider context using the health map to support creation of the outbound referrals. From a workflow impact perspective, it essentially is a launch out from the system. So from a user perspective, it essentially just saves them time for having to credential into Ocean, which is beneficial, as you can imagine, when physicians are issuing multiple referrals in a day.
Perfect. The next question is from David from Mackenzie Health. Since Epic and Ocean has all the data, it'd be neat to integrate the two without the middleware. Is this something possible?
It sure would be neat to integrate without the middleware. That is really something that the vendors, the EMR vendors really do need to do, is be able to have the ability to interface more directly with FHIR resources. Epic as a vendor is creating more and more FHIR functionality for themselves, for other people to come into, and so they also need to do the reverse of that, which is to really come up with the ability to consume that FHIR information from other ones. They don't have that in place at this point in time, and hence our middleware that we created.
And if I could just add on to that, that's a great answer. Just to also point out that, the upside and the downside of having a pan-Canadian e-referral standard is that it does mean that we have made certain design decisions that those vendors then have to decide if that's something they want to support as part of their base release or not. Again, that's something that I think the more that customers make it clear to their providers that this is something that they would value out of the box, the more likely it'll hit the roadmap.
Perfect. I hope we answered your question, David. As I don't see any other questions in the chat, so I'll give a few more minutes to the 150 attendees that are here today if they have any other questions. Perfect. In the meantime, I'll just share the upcoming sessions while people are asking all the other questions in the chat. So the upcoming sessions at 4 p.m. or 1 p.m. Pacific time is how to build an interoperable FHIR iGuide that will get adopted. There's also a code camp at 4 p.m., which is 1 p.m., developing a successful Smart on FHIR implementation from concept to launch, which would be interesting. And you'd also want to check out any pre-recorded sessions that we have down in the sessions and gamification corner. Perfect. So I don't see any questions so far. Perfect. Well, I think it's safe to say that they don't have any more questions. Perfect. Well, thank you so much, everyone. Thank you so much to the speakers and the presenters as well. Oh, wait, I guess we do have another question. So David also asked, just curious, how many developers there for the middleware development?
We had two, myself and one of my staff, one of my analysts were involved in it.
Perfect. Anything else coming in? Just a lot of thank yous and great job and accomplishments is what I see coming through the chat right now. Perfect. Well, so again, thank you so much, everyone, for attending this session. And there's, again, go back. The upcoming sessions are here. Feel free to check the sessions out, or any gamification or networking on the side on your left. Thank you so much, everyone.
Thank you.
Done.
Well done. Well done. Oscar winning a performance.
We are amazing.
Okay.